Classifications in orthopedics. Allmar's classification. It is used for fracture clavicle. Rockwood's classification. It is used for acromioclavicular joint fracture. Neer's classification for fracture proximal humerus. Matson's classification for recurrent shoulder dislocation. Gotland's classification for supracondylar fracture of humerus. Mill's classification. It is used for fracture lateral condyle of humerus. Manson's classification for fracture head of radius. Bardot's classification for Monteggia's fracture. Frickman's classification, Fernandez, Maloney's classification. These are used for fracture distal end of radius. Judd's classification for acetabulum fracture. Young's and Burgess and Tile's classification for fracture pelvis. Anatomical classification, Powell's classification, Gordon's classification. These three are used for fracture neck of femur. Boyd and Griffiths and Evans classification for fracture intertrochanteric fracture. Delbet's classification for fracture proximal femur of children. Popkin's classification for fracture head of femur. Thompson and Epstein's classification for posterior hip dislocation. Winquist and Hansen's classification for fracture shaft of femur. Schatzker's classification for fracture proximal tibia. Rudy and Algover's classification and Papa's classification is used for pylonis fracture. Splints, casts and tractions in orthopedics. Coaptation splint is used for fracture shaft of humerus. Cock-up splint is used for radial nerve palsy or wrist drop. Knuckle bender splint is used for ulnar nerve palsy or claw hand. Aeroplane splint is used for brachial plexus palsy. Turnbuckle splint is used for Volkmann's ischemic contracture. Dennis Brown splint is used for CTEV, congenital talipes equinovarus. Aluminum splint is used for phalangeal fracture. Casts. Minerva cast is used for cervical spine injury. Risser's cast is used for scoliosis. For scoliosis, turnbuckle cast is also used. Turnbuckle splint is used for Volkmann ischemic contracture, but turnbuckle cast is used for scoliosis. U-cast or hanging cast is used for fracture shaft of humerus. Patellar tendon bearing cast is used for fracture shaft of tibia. Handshake cast is used for Colles fracture. Glass holding cast is used for fracture scaphoid. Bachelor's cast is used for DDH, developmental dislocation of hip. Sling and swath bandage is used for shoulder dislocation. Velpa bandage is used for acromioclavicular joint injury. Dunlop's traction and Smith's traction is used for supracondylar fracture of humerus. Gallo's traction and Bryant's traction are used for fracture shaft of femur in less than 2 years old. Buck's traction used for skin traction. Perkins traction, it is subtrochanteric fracture of femur. Gardenwell's traction and Crutchfield tongs are used for cervical spine injury. Angles and triangles in orthopedics. Bowman's angle, it is in supracondylar fracture of humerus. Cobb's angle, it is present in scoliosis. Weber's CE angle, it is present in DDH. Powell's or Gordon's angle, it is present in fracture neck of femur. Mary's angle, it is in pes cavus or pes planus. Hilgen-Reiner's epiphyseal angle, it is seen in congenital coxa vara. Babcock's triangle, it is present in fracture neck of femur or TB hip. Ward's triangle, it is present in neck of femur. It is used for grading of osteoporosis. Fairbank's triangle, it is present in congenital coxa vara, also known as Perthes disease. K angle or kyphosis angle or Dixon's angle, it is seen in Pott's spine. Quadriceps angle, it is seen in recurrent patellar dislocation. Kite's angle, it is present in CTEV. Kite's angle is talocalcaneal angle. X-ray views in orthopedics. Janka view used for acromioclavicular joint. Stryker's notch view used for Hill-Sachs lesions. West point axillary view used for Bunkardt's lesion. Oblique or PA view in ulnar deviation is used for scaphoid. Van Rosen view is used in DDH. Merchant's view is used for patellar subluxation. Morty's view used for AP view of ankle with ankle in 15 degrees of internal rotation, done for delineation of syndesmotic injury. Canale view is used for fracture of talar neck. Harris or Broden view used for fracture calcaneum. Serendipity view used for sternoclavicular joint. Ball catcher's view is used for erosion in the rheumatoid arthritis. Judette view is used in fracture acetabulum. Swimmer's view is used for lateral view of cervical spine to assess lower cervical spine injury.